Hello friends, and welcome back to the channel. If you're on Medicare and taking 3 or more prescription medications, I'm going to show you in the next few minutes how to find out whether you're on the wrong drug plan, what it's actually costing you, and the specific steps to fix it, including a federal program that caps what you pay per prescription at under $15. These are not complicated changes, but they're changes most people on Medicare have never been told they could make. What I'm covering today is not about switching doctors or changing your coverage in ways that feel risky or complicated. It's about making sure the plan you're already paying for is actually working for you and finding out about the programs that exist specifically to lower your drug costs if it isn't. The difference between the right plan and the wrong one for someone taking 3 or more medications can be anywhere from a few hundred to over $1,000 a year. That money either stays in your pocket or it doesn't. Today we're going to make sure it stays in yours. Here's the first thing I want you to understand. Having Medicare Part D does not mean you're getting the best price on your medications. It means you have drug coverage. Those are two very different things. Medicare Part D is not one plan. It's a category of plans. There are dozens of them available in every state, and each one has its own list of covered drugs, called a formulary, its own pricing tiers, and its own monthly premium. A medication that costs you $45 on your current plan might cost $12 on a different plan. The drug is identical. The only thing that changed is the plan covering it. Most people pick a Part D plan once when they first sign up for Medicare, and then they stay on that plan year after year without ever checking whether it's still the right fit. Meanwhile, their medications change. The plan's formulary changes. The pricing tiers shift. And every year that goes by without a review is another year of potentially overpaying for drugs that a different plan would cover for significantly less. The Kaiser Family Foundation has reported that fewer than 30% of Medicare beneficiaries actively compare plans during open enrollment each year. That means the majority of people on Medicare are just staying put and hoping their plan is still working for them. For someone on 1 or 2 medications, that might be fine. For someone on 3 or more, it's almost always costing them money they don't have to spend. Medicare built a free tool specifically for this problem. It's called the Medicare Plan Finder, and it's available at medicare.gov. Here's how it works and why it matters. You go to medicare.gov and click on Find a Medicare Plan. You enter your zip code and your medications, every single one, including the dosage and how often you take it. The tool then pulls up every Part D plan available in your area and shows you the total estimated annual cost for each one, based on your specific drug list, not a general estimate. Your drugs, your doses, your costs, compared across every available plan. What most people see when they do this for the first time is a significant spread between the most expensive option and the least expensive one. It is not unusual to see a difference of $800 to $1,500 per year in total drug costs between the highest and lowest options for the same set of medications. That's a real number. That's money that either goes to an insurance company or stays with you. The Plan Finder also shows you whether your specific medications are covered under each plan, what tier they fall into, and whether any of them require prior authorization or have quantity limits. All of that information in one place, for free, before you make any decision. The window to use this tool and actually make a change is Medicare's open enrollment period, which runs every year from October 15th through December 7th. Any change you make during that window takes effect January 1st of the following year. Outside of that window, you generally cannot switch plans unless you qualify for a special enrollment period. So if open enrollment is approaching, this is the time to act. And if it just passed, now is the time to start preparing so you're ready when it opens again. Here's something that catches people completely off guard. Every year, Part D plans are allowed to change their formularies. That means a drug that was on Tier 2 last year, relatively affordable, can move to Tier 3 or Tier 4 this year. And your cost for that medication can double or triple overnight. Your plan is required to notify you of these changes. They send a letter, usually in the fall, called the Annual Notice of Change. It arrives in the mail. It's several pages long, and most people set it aside and never read it. Inside that letter is a list of every change the plan is making for the coming year. Premium increases, formulary changes, coverage shifts. If one of your medications moved to a higher tier, that information is in there. If you didn't read it, you found out at the pharmacy counter when the price was suddenly different. starting right now. When that letter arrives, open it. Look specifically for any medications you currently take. Check whether their tier designation has changed. If it has, that is your signal to go back to Medicare.gov, run the plan finder again, and see whether a different plan would cover that drug at a lower cost. This one habit, reading the annual notice of change every fall, can save people on multiple medications hundreds of dollars every single year. It takes about 10 minutes, and it's the kind of thing that makes the difference between a manageable drug budget and one that keeps quietly climbing. Now I want to talk about a program that applies specifically to people with limited income, because if you qualify for it, everything I've covered so far becomes even more significant. The program is called Extra Help. It's also referred to as the Low-Income Subsidy. It's a federal program administered by Social Security, and what it does is cap what you pay for covered prescriptions to a very small amount regardless of which tier your drug is on or what your plan normally charges. In 2026, if you qualify for Extra Help, the most you pay per prescription is $4.50 for a generic medication or $11.20 for a brand-name drug. Per prescription, that's the ceiling. No matter what the drug costs, no matter what tier it's on, compare that to what people without this program pay. Tier 3 drugs commonly run $45 to $95 per month. Tier 4 specialty drugs can run $100, $200, even more. For someone on 3, 4, or 5 medications, Extra Help can translate to savings of $150 to $400 every single month. The income limit to qualify in 2026 is approximately $23,900 per year for a single person, or around $32,260 for a married couple. Resources, meaning savings, investments, and assets other than your home and car, are also considered. Single applicants can have up to roughly $17,220 in countable resources. Married couples up to approximately $34,360. If you're already enrolled in a Medicare savings program through your state Medicaid office, programs like QMB, SLMB, or QI, you're automatically enrolled in Extra Help. No separate application needed. If you're not in one of those programs, and you think you might be near these income and resource limits, it's worth applying even if you're not certain you qualify. The application is free, it's straightforward, and the SSA will tell you whether you're eligible. You can apply online at ssa.gov by calling 1-800-772-1213 or by walking into any Social Security office. The application takes about 15 to 20 minutes. If you qualify, the savings begin with your next prescription. There's one more thing I want to cover, and it doesn't involve switching plans or filling out applications. It involves a conversation with your pharmacist that most people on Medicare don't know they're entitled to have for free. It's called a Medication Therapy Management Program, or MTM. Medicare requires Part D plans to offer this program to members who have multiple chronic conditions, take multiple medications, and are likely to have high drug costs. If you meet those criteria, and most people on 3 or more medications do, your plan is required to reach out to you and offer this service at no cost. What it involves is a comprehensive review of every medication you take, conducted by a pharmacist or other qualified healthcare professional. They look at whether your drugs are working together the way they should, whether any of them could be replaced with a lower-cost generic, whether any of them are duplicating each other, and whether there are less expensive therapeutic alternatives for any condition you're managing. This review does not replace your doctor. It doesn't change your prescriptions without your doctor's approval. What it does is give you and your doctor better information, and in some cases, it identifies changes that reduce your drug costs significantly. If your plan has never contacted you about this program, call the Member Services number on the back of your insurance card and ask directly whether you qualify for medication therapy management. If you do qualify, request the review. It is free, it is comprehensive, and it is a benefit you are already paying for through your Part D premium, whether you use it or not. Let me bring this all together. If you're on Medicare and taking 3 or more prescription medications, here's what to do. First, go to Medicare.gov and use the free Plan Finder tool. Enter every medication you take, every dosage, and compare what you'd actually pay across every plan available in your area. The difference between plans can be $800 to $1,500 per year for the same medications. Second, when your annual notice of change arrives every fall, read it. Look for any changes to your medications tier placement. If something moved to a higher tier, use that as your signal to compare plans before open enrollment closes on December 7th. Third, if your income is under approximately $23,900 a year as a single person, look into extra help through Social Security. It caps your prescription cost at under $12 per medication, and the application is free. Fourth, call your Part D plan and ask whether you qualify for a medication therapy management review. It's free, it's comprehensive, and it can identify lower-cost options for drugs you may have been overpaying for without knowing it. None of these steps are complicated. None of them require you to give anything up. They just require knowing the options exist, and now you do. If this video helped you, please subscribe to this channel and turn on the bell notification. Every year, Medicare's rules, income limits, and plan options change, and when they do, I break down exactly what those changes mean for you specifically. In plain language, before the deadlines arrive, the people who are subscribed find out in time to act. Share this video with someone you know who's on Medicare and managing multiple medications. One conversation could save them real money starting with their very next refill. I'll see you in the next one.